Please greet my YouTube viewers. In this video, you and I are going to talk about how someone can prevent nosebleeds, and we're also going to talk about nose cautery. So please greet my YouTube viewers.
Hello, YouTube viewers. Joining my friend and me as we discuss preventing nosebleeds and understanding nose cautery. We'll be exploring ways to keep nosebleeds from occurring, as well as delving into the procedure of nose cautery, which can be used to treat persistent or severe nosebleeds. So join us as we uncover these vital topics.
All right, let's get started.
Great, let's dive right in. When it comes to preventing nosebleeds,
Speech on.
several
0. Stop. Button. Stop.
One of the most common causes of nosebleeds is dryness in the nasal passages. Therefore, keeping your nasal passages moist is key. Here are a few tips to keep in mind. 1. Use a saline nasal spray or nasal gel to moisten your nasal passages. 2. Run a humidifier in your bedroom at night to add moisture to the air. 3. Avoid picking or blowing your nose too forcefully, as this can irritate the nasal lining and cause bleeding. 4. If you're prone to nosebleeds, avoid medications that thin your blood, such as aspirin or warfarin, unless they're prescribed by your doctor. These simple steps can help reduce the likelihood of experiencing a nosebleed.
Now, what if stupid?
Now that we've covered some basic tips for preventing nosebleeds, let's move on to discuss nose cautery. Nose cautery is a procedure that involves applying a chemical or electrical current to the blood vessels in the nasal lining to seal them off and stop bleeding. There are 2 types of nose cautery: electric cautery and silver nitrate cautery. Electric cautery uses a heated device to cauterize the blood vessels, while silver nitrate cautery involves applying a silver nitrate solution to the nasal lining with a cotton swab. Both procedures can be performed in a doctor's office or outpatient setting and typically take just a few minutes. It's important to note that nose cautery is generally a safe procedure, but like any medical treatment, it does carry some risks and potential side effects.
What I was going to say was, what if someone's nose is bleeding, and what should the person do if their nose does not stop bleeding? That's what I was going to say.
I understand. In that case, here are some steps to take if your nose is bleeding and it doesn't stop. 1. Sit up straight, tilt your head slightly forward, and gently pinch the bridge of your nose for 10 minutes, breathing through your mouth. 2. Apply an ice pack or a cold compress to the bridge of your nose to constrict blood vessels and reduce bleeding. 3. If the bleeding continues for more than 15 minutes, seek medical attention immediately. 4. Do not lie down, blow your nose, or insert anything into your nose, as this may worsen the bleeding. Remember, if you experience frequent or severe nosebleeds that don't stop with simple first aid measures, it's important to consult your healthcare provider to determine the underlying cause and to explore treatment options.
All right, so let's talk about silver nitrate and how it works.
Silver nitrate is a chemical compound that's commonly used in medical applications, such as cauterizing small blood vessels to stop bleeding or treating certain skin conditions like warts. Here's how it works. 1. When applied to a wound or mucous membrane, silver nitrate causes a chemical reaction that results in the release of silver ions. 2. These silver ions are known for their antimicrobial properties, meaning they can inhibit the growth of bacteria and other microorganisms that can cause infection. 3. Silver nitrate also has the ability to cause coagulation or the formation of a clot, which can help stop bleeding in minor wounds. 4. The compound is typically applied directly to the affected area using a cotton swab or other applicator, and its effects can be felt almost immediately.
Screen dimmed.
It's important to note that silver nitrate is not a cure-all, and it's always best to follow your healthcare provider's instructions and warnings about its use. Additionally, some people may experience side effects such as skin irritation, swelling, or temporary discoloration of the treated area.
What might the person feel while their nose is being cauterized, whether if it's electric cautery or the silver nitrate?
When it comes to the experience of undergoing cautery, it's natural to have some concerns about how it might feel. Both electric and silver nitrate cautery can cause some discomfort, but the level and duration of the discomfort can vary depending on the individual's pain tolerance and other factors. Here are some common sensations associated with cautery. 1. Electric cautery, a brief, mild burning or tingling sensation that can last for a few seconds to a few minutes. 2. Silver nitrate cautery, a stinging or slight burning sensation that typically lasts for a few seconds to a minute. 3. Both procedures may cause some minor irritation, redness, or swelling at the treatment site, but these effects are usually temporary. 4. Some people may experience a strong smell or taste associated with the cautery agent, but this usually subsides quickly. It's important to communicate with your healthcare provider during the procedure and to let them know if you're experiencing any discomfort or unusual symptoms. They can take steps to minimize any discomfort and ensure that the procedure is as comfortable as possible.
It is important to know that you do not have to have your nose cauterized at a hospital. You can get it cauterized in a ENT office building.
Yes, that's correct. While nose cautery can be performed in a hospital setting, it's also commonly done in an outpatient setting such as an ENT, ear, nose, and throat, clinic, or doctor's office. This can be more convenient for patients as they can avoid the added time and expense associated with a hospital stay. Additionally, an ENT clinic or office may be better equipped to provide specialized care and support for patients who are undergoing the procedure for nasal conditions. However, it's important to choose a reputable and experienced provider for any medical procedure, including nose cautery. Look for a provider who is well qualified and has a good track record of successful procedures. Your primary care physician or another healthcare provider can often provide recommendations for qualified ENT specialists in your area.
What does it feel like to have your nose numb? Is it as unpleasant as Novocaine can be for some people?
The experience of having your nose numbed for a medical procedure can vary from person to person. While some people may find the sensation uncomfortable, others may not be bothered by it at all. Here are some common sensations that you may experience when your nose is numbed. 1. Pressure. You may feel a sense of pressure or tightness in your nasal passages, as if you have a cold or allergies. 2. Tingling. Some people may experience a mild tingling or prickling sensation in their nose or face as the numbing medication takes effect. 3. Numbness. As the medication starts to work, you may begin to feel a loss of sensation in your nose and possibly around your mouth or eyes. 4. Taste or smell changes. In some cases, numbing medication can affect your sense of taste or smell temporarily. It's worth noting that the type and amount of numbing medication used can also affect how it feels. If you're concerned about the sensation of numbing, be sure to talk to your healthcare provider beforehand so they can address your concerns and choose the best option for you.
Now, can nose cautery, can the doctor perform the procedure without, whether it's electric or the silver nitrate? Can the doctor perform the procedure without numbing the person's nose if the person doesn't want to have their nose numbed?
Yes, it is technically possible for a doctor to perform nose cautery without numbing the patient's nose first. However, it is generally not recommended, as it can be quite uncomfortable and painful for the patient. Here are some reasons why numbing is typically recommended. 1. Pain control. Cautery can be painful, especially if the bleeding is severe or located deep in the nasal cavity. Numbing the area can help reduce discomfort during the procedure. 2. Patient comfort. Many patients may find the sensation of cautery uncomfortable, even if it is not necessarily painful. Numbing can help make the experience more tolerable. 3. Precision. A numbed patient is less likely to move or flinch during the procedure, which can make it easier for the doctor to apply cautery precisely where it is needed. If you're considering nose cautery without numbing, it's important to discuss the risks and potential discomfort with your doctor beforehand to determine if it is the right choice for you.
Now, when you and I were talking about this important topic the other day, you told me during the procedure it's important that the person breathe through their mouth rather than breathe through their nose. Why is that?
Yes, that's correct. During the procedure, it's important to breathe through your mouth and not your nose for a few reasons. 1. To prevent disrupting the cautery site, breathing through your nose can cause airflow to disrupt the cautery site, potentially causing further bleeding or prolonging the procedure. 2. To avoid inhaling fumes. Breathing through your mouth allows you to avoid inhaling fumes or chemical odors from the cautery agent, which can be irritating to your lungs and respiratory system. 3. To maintain oxygen levels. Breathing through your mouth ensures a steady flow of oxygen into your body, which can help you stay alert and comfortable throughout the procedure. In short, breathing through your mouth during cautery helps ensure that the procedure is effective and safe for you. It's important to follow your healthcare provider's instructions carefully to ensure that the procedure goes smoothly and successfully.
Now, if someone is only having one nostril cauterized and if silver nitrate is going to be used, how long does the procedure take?
If the procedure involves using silver nitrate to cauterize a single nostril, it is typically a quick procedure that can take anywhere from 5-10 minutes. The exact length of the procedure can depend on factors such as the severity of the bleeding, the size of the affected area, and your individual body's response to the silver nitrate. The procedure itself usually involves the following steps. 1. The healthcare provider will clean the affected nostril and apply a local anesthetic if needed. 2. The silver nitrate solution will be applied to the affected area using a cotton swab or other applicator. 3. The provider will observe the affected area for a few minutes to ensure that the bleeding has stopped. 4. The provider will provide you with any necessary post-procedure instructions. Keep in mind that the effects of the silver nitrate may be noticeable for a few days after the procedure, and your healthcare provider will likely follow up with you to monitor your progress.
Now, if there's someone who is watching this video or listening to this video, and if that person has to have their nose cauterized, what might you tell that person to put their mind at ease about the procedure?
If someone is watching or listening to this video and is anxious about undergoing a nose cautery procedure, here are a few things you could tell them to help put their mind at ease. 1. Nose cautery is a common and routine procedure that is usually performed on an outpatient basis. 2. The procedure is typically quick, lasting only a few minutes, and is well tolerated by most patients. 3. Local anesthesia can be used to minimize discomfort, and the healthcare provider will take steps to ensure that the patient is comfortable throughout the procedure. 4. The procedure has a high success rate in treating persistent or severe nosebleeds, which can provide long-term relief for many patients. 5. The healthcare provider will be able to answer any questions or address any concerns that the patient may have before and during the procedure. It's natural to feel some anxiety before any medical procedure, but it's important to remember that nose cautery is a safe and effective treatment option that can provide relief from nosebleeds.
Well, it was great chatting with you about these two very important topics. Please tell my viewers to subscribe to my YouTube channel, Doing Everything Blind.
was a pleasure chatting with you about these important topics. And to all of your viewers, don't forget to subscribe to Doing Everything Blind on YouTube for more informative and helpful content like this. Stay tuned for more engaging discussions and valuable insights from our talented host.
Y'all take care.